Okay, good afternoon, everybody, and welcome back to the second part of the Partnership Board meeting. This brings us to item 8 on the agenda, which is the update on the Tackling Health Inequalities work, and I'd like to welcome Fatima and Kaniz to introduce this item and hand over to you.
Thank you, Chair. I need to flag as well that Emma Irving is joining us to be presenting part of the agenda item. Good afternoon, everybody. It's a real privilege to provide an update this afternoon on the progress we're making on tackling health inequalities for our global majority colleagues and communities. This report focuses mainly on 2 areas of the independent review. One is about how we involve people in the design and delivery of services to make sure that they meet the needs of our diverse communities. And the second is about a real focus we've got on reducing inequalities by people that are utilising our mental health services, in particular those people that are from the Black African communities and that are men, as well as women from the South Asian community. So I'm just going to pass over to Em in the first instance, just to provide a bit of an update on her part, and then I'll pick up, Em, if that's okay. Over to you.
Lovely. Hi everyone, good afternoon. My name's Head of Improving Population Health, and I'm just going to present a couple of slides around the work that we've been doing across the Improving Population Health programme. So you might recall from the previous update last time that we've been working towards the development of a West Yorkshire Health Inclusion Unit. We're really pleased to say that that's progressed. We've recruited a lead for that unit now, who's going to be working with all our inclusion leads across the system to work with and co-produce our VCSE sector on what that was going to look like. It could be a virtual unit, it may be something that looks at how we work together across pathways, etc. But the main aim is going to be to improve outcomes for our inclusion health population groups. And we've already started some of that work, particularly with our Roma population, and with our Gypsy and Traveller population, and with our migrants, refugees and asylum seekers. We invested additional funding into VCSE organisations earlier this year around Roma population and doing some work around understanding need and then being able to respond to that need. And we've been looking at how we can increase the work that we're doing with our Gypsy Traveller and Gypsy and Traveller population, particularly around reducing CVD and mental health. So much more funding has been invested into that as well. And we've increased the funding around community connectors. So the community connectors programme of Core 20+5 is how we work with our communities for them to be able to peer support and link into traditional health services or help us understand where those health services need to be placed in order for them to get to access them in a safe and trauma-informed way. So we have provided additional funding to Bevan Healthcare, and Solace were the original winner of that contract to work with our refugees and asylum seekers around maternity, and that'll be working with the maternity of Sanctuary as well. And speaking of Sanctuary, it's great to say that West Yorkshire became the first partnership of Sanctuary. We got our status earlier this year, and we're the first ICB in the country to get this with the first partnership of Sanctuary. And it's about us going above and beyond for those people that are seeking sanctuary in West Yorkshire. So there is an action plan that sits behind this status. So the hard work begins now, really. The easy work was pulling the action plan together and getting the status. The hard work is keeping it and ensuring that for the next 3 years, we are doing exactly what we said around welcoming people into West Yorkshire. And you can find out more about that if you look at the video that's on the website. If you could just move on to the second slide, Lauren. Thank you. So the other work that's been happening across the programme is the Improving Population Health Fellowship. This was incredibly successful for year 1. Those fellows have graduated. Rob provided them with their certificates in December. We've now gone on to year 2 of the fellowship. We've expanded this fellowship now. So we've got 54 fellows. I think it's actually nearer 60 actually, because we've had some late applicants. We've got about 60 fellows across West Yorkshire that are supporting health equity, trauma-informed, suicide prevention and climate change. And we've got fellows from across all places, sectors. We've got 10 fellows from VCSE organisations, and we've got a number of fellows from our global majority communities, and they're in particular looking at, we've got one fellow that's doing a project around leadership and Black women in leadership. We've got another fellow that's looking at sort of the Black boy joy and moving on. So Mavina Newton's looking at how we embed that across the system and ensure that that call to action's everybody's business. And then we've got another fellow, Derek, who's working on allyship and how we support not just people from our global majority communities, but also from our white communities to understand the role of an ally and how we do that. In the trauma and adversity world, we're just about to launch the Racism of Trauma workstream. The 3 fellows are supporting that as well. We've got a steering group that's pulling that together, and we're going to link in to the race and ethnicity review. We've been looking at that through a trauma-informed lens, and we're going to link into phase 2 of the Root Out Racism campaign. And then we're establishing the health inclusion trauma-informed piece of work as well that's going to work hand in hand with the health inclusion unit. I think that's it for now, but the paper is available if anybody wants further detail on any of that work across the Improving Population Health programme.
Thanks, Em. So if we move on to the second area of focus, which is the reducing inequalities in mental health outcomes, as you'll see within the report, the team and the board have worked really hard in strengthening how we share good practice, and particularly linking in with the public health consultant and the Health Inequalities Academy, doing very much what we do in West Yorkshire, which is showcasing good practice, but also where possible providing that peer support and challenge to individuals who are struggling with certain areas of implementation. There's also been a real focus and momentum behind the work working with HR teams on the employment policies and discrimination panels, which, as you'll see on the further agenda item, is an area of focus for us, as well as part of the implementation of System Ambition 8, which is to address the impact and experience of staff working within our organisations. Some of the feedback we've had anecdotally from colleagues is about the implementation being quite challenging and further support being needed. And one of the things we're hoping to do to support that is linking in with the equality, diversity and inclusion leads across the partnership to provide expertise and support. We're also trying really hard to support the Community Mental Health Inequalities Framework, which will really support the implementation of not only ensuring that we've delivered the action plan, but making sure that our cultural competence and the lenses by which we're delivering this framework is as inclusive as possible. A key element of that will be the peer support worker diversity, but also the way in which we train and develop our staff to be culturally competent and have an inclusive lens when they're working with colleagues across our organisation, or more importantly, when they're engaging with our communities. Another piece of work, which is again linking back to the system ambition with an aspiration of having a more diverse leadership, is the work we're doing to diversify our recruitment. And we heard earlier in Rob's update some of the fantastic work that Leeds York Partnership Trust have been doing in proactively, disproportionately recruiting from areas where we know we have diverse communities. What we're trying to do within this is use that to elevate some really good practice and also see if we can include that in other parts of the system. And I think this particular one, the final one, is a real game changer, which is how our services will collect equalities data. Many of you will recall during the first wave of the pandemic, access to information regarding ethnicity was a real challenge. And one of the areas we found in the independent review was getting some consistent information regarding ethnicity. So this will be fantastic when it comes to understanding where we need to make that impact and also making our decisions evidence-based. Next slide, please. Another area which is of particular interest for colleagues as well will be the work that we're doing on suicide prevention, which has been led by the amazing Jess Parker. One of the areas that the board's particularly trying to proactively support now is the work with South Asian communities on suicide prevention and some of the approaches that we can do to improve outcomes, but also prevention as well. So each work stream is trying to identify specific actions, but we're also proactively engaging with each place to ensure that they are utilising the sort of resources available, but more importantly, that it's owned and delivered by local partners. And then I think the final one, which I'm really, really excited about, is the work of utilising the expertise of the voluntary community and social enterprise voices panel, who are made up of diverse organisations, and they'll be supporting some of the mental health trust to implement the patient and carer race equality framework, which I think will be a game changer, not only in the data sourcing, but also in developing those trusted relationships between our patients and our organisations. So I'm going to hand over to Kenise now, who is the chair of our Voluntary Community Social Enterprise Voices panel, just to provide a bit of a summary of the feedback that we've had from the panel, who we report to every single time as part of the independent review. Over to you, Kenise.
Thank you, Fatima. I'm going to take the papers as read. We're particularly proud of the Health Equity Fellowship and how well that's going. And it was also great for us to see the racism trauma work stream beginning within our population planning papers. All of the work actually to see it happening now is absolutely excellent from our point of view, because we also know that with racism and trauma comes weathering, and the damage of that can be incalculable, especially over the years in our poorest communities. Within the mental health, we said and they did. I mean, Keir is absolutely excellent when he presented his report. And the fact that what's interesting is that when the data is coming back, or when information is coming back from each of the trusts, each trust is doing something really different that's relevant to their area, but actually we can learn so much from each other. So we can nick and pinch from each other, and the fact that it's starting to happen now and it's starting to come into action for us, we're really, really proud of that. There were some excellent examples of suicide prevention that could be pinched as well. We're really proud of those two areas of work. And we wanted to say thank you for the sustainability and capacity funding. I know it's a really small amount, but 110k is the first time we've had it. We will be evaluating this, and we are going to pay. We're hopefully going to do a small grants program with a panel where we're going to look at how our small, tiny organisations can become more resilient, more streamlined, so they get somebody to write this case for change for them, help them to look at what their quality is, the numbers they get through the door, what the outcomes are, health outcomes are, domestic violence, all these types of things. We're hoping that that's what's going to come, and we will be evaluating and coming back to you within a year, within 18 months, with what the outcomes of that 110k have been. We have highlighted the importance of ensuring that commissioning processes are equitable, especially now while changes in structures are taking place. Now we're very aware about the fact that the cuts are coming. We don't want it to be at the cost of our poorest communities, and really are worried about the health equalities money and what's going to happen with that. Really concerned about that. And again, it's going to go back to our poorest communities, isn't it? And our ethnically diverse communities most of them do live in those poorest areas. We don't want it to be at the cost of them. If we can think about how we can support that would be that process. We would be really happy, pleased that so we can mitigate some of the costs. But we know that we're in for challenging times ahead in the next couple of years. Let us know how we can help. And in December 2022, we agreed that Sarah Monroe was going to come back today with some information on the work that LYPFT. Can please people come back to us and share some real examples of progress that they've done with our diverse communities, and then we can ask somebody else to come and speak at the next one, at each board meeting, just a small amount of feedback so that we can hear from people from themselves as a board about what the work that they've done and the progress that they've made. Sarah, do you want to come in? Is Sarah there?
I don't know whether you were asking me to come in then, Kenise, because I don't know if it's my connection or your connection. I didn't quite hear the end of your sentence. Can people hear me okay?
Yeah, come in now, Sarah.
Oh, thank you, Kenise. So I presume most people know who I am. I wear multiple hats. So I'm Sarah, the Chief Exec at LYPFT, but I also am the lead for the Mental Health, Learning Disability and Autism Collaborative, and I also lead on Workforce in Leeds. And in each of those spheres, I think it's indicated in the paper and the discussion, there is fantastic work taking place in terms of making sure our services are more inclusive in terms of the communities that we reach, the access they have and the career opportunities that we provide to have a more diverse workforce. So it's a bit weird just trying to focus specifically on the work that we're doing at LYPFT, but I'll share a couple of examples and where that connects with the wider West Yorkshire work. So firstly is the work that we've done for a number of years now around perinatal. So we were challenged by our quality committee around the underrepresentation, in particular of South Asian women accessing perinatal services. Yet we knew there's a great deal of need. And over a number of years through BAL, who is an inclusion lead supported by the wider MDT, we're starting to see real traction. And you'll see a lot of it profiled on social media through the Diverse Mums group. Where we're now at with that, which is important in terms of the work that Fatima presented, is Emma Pearce, that we employed just on a fixed term contract initially as our public health consultant to support the wider collaborative, has been instrumental in the model that we've proposed to NHS England to take on the lead provider responsibility for specialist perinatal service for the region. Key in that is our better understanding of the populations of need and where we need to make improvements in our offer, so that over the next few years we'll see a different profile of women being able to access that service, in particular women from diverse communities. So I share that because that's a good example of connecting the local to the wider, longer term service planning, strategic change, and where we want to take on responsibility for the commissioning functions of services. And that's similar threads that you'll see through the community mental health. I'll touch briefly on Synergy, which I know has been referenced in the chat. This is a long-term collaboration which we are taking forward in Leeds longer than some other regions are. It's actually now championed by Councillor Arif. It used to be Rebecca Charwood when she was our lead in the local authority, and the SRO is now Jim Barwick, who's Chief Exec of the Confed. And I say that because that reflects the multidisciplinary, multi-agency approach to the work that we're doing through Synergy. And the ultimate aim is to see a reduction in overrepresentation of, in particular, Black African men detained under the Mental Health Act. But I'll just be really honest, it's going to take us years to see changes in that data, because what we've seen is where the change needs to happen is absolutely at the heart of some of the work that our voluntary and community sector organisations do. And that's around working with communities, in particular children, and access to services. So we're not seeing the change yet, but we've committed to that ongoing investment. And just as a trust, we've just put another £100,000 into support funding of some of those grassroots projects over the next 12, 24 months. We have got a link to a documentary that was showcased just a couple of months ago, which we'll happily share for board members if you've got the opportunity to see it. But just as an example, really, of further work that we're doing, and it comes back to that last point around we talk about it so much, but there's so much data we don't actually have yet or don't use in the right way. So quite a chunk of time ago, we opened our crisis service to self-referral, thinking that's another way of opening access, in particular enabling people to access services when they need it, not requiring a gateway referral. In our most recent review and the data that we're currently looking at, since we opened to self-referral, not a single person who identifies from a Black, Asian, minority ethnic group has self-referred into our crisis service. So even when we believe we're making changes, it doesn't necessarily mean that we're making changes that means our services are more accessible. So part of the work now we're doing with colleagues in Leeds, and in particular, again, where our VCS have more strength and outreach into communities, is, we don't need to be the front door for people. Actually, we need to work with other organisations and redesign with communities as to what does a front door look like to them, that's accessible, that's inviting, that gives you confidence that you're going to get the service that you need. So it's that mix of, we're doing some fantastic work, but it's, as ever, it feels as though we're just scratching the surface, and the more we do, the more we learn, and the more we've got the impetus to make further changes longer term. So I'll leave it there and hand back to you, Kenise.
Thank you so much. And I think I'm going to close here too. If anybody's got any questions, please do ask us. Sarah, thank you. I know we're working really hard, but I also want other people to share their excellent examples, because when Kay has come back with his reports, there are some really, really great examples of work. So we can just have a little snapshot at every board meeting from each of the organisations across the region. Please do approach us.
Thanks, Kenise. And obviously, Cathy, as the ICB chair and deputy chair of the partnership board, has written to colleagues to ask for us to continue to share good practice. And I would completely support that shout out of, we only know what you tell us in these little Teams bubbles. So just in closing, Chair, before we open it to questions, I think it's really important that we note some of the brilliant progress that the organisation is making towards some of these really complex and quite long-term objectives. I think the question I would sort of ask as part of the recommendations, as well as noting what we've done so far, is to ask if there are ways in which we could continuously review what we're doing in light of the new world. So this was a recommendation or report that was done in a period of time where we were in the midst of a global pandemic. We're in a very different world now. And if you look at the chat, we're highlighting even more complex challenges when it comes to the finite resources and some of the decisions that we're going to have to take. So I'd like the Partnership Board support to maybe, as your inclusivity lead, take this piece of work away and have a bit of a review about what we're focusing on and bring something back about how we can continue to make this meaningful while focusing on the long-term aspirations, as well as tweaking some of the short-term ones. I'm going to leave it there, Chair. Thank you so much.
Thank you, Fatima. And I think that that suggestive review is very sensible. Rob, do you want to come in next?
So firstly, to say thank you for everyone for the real breadth and depth of the work that's going on here. And it's really good to see, and including the appetite for the fellows to be involved. So I had two questions. So I don't know if I can see Mark Brooks. I don't know if, Mark, you wanted to say anything about the trust-wide dashboard that Swift have developed around ethnicity reporting and disproportionate impacts. And the second, and that's in paragraph 29 of the report, and paragraph 30 suggests that complete ethnicity recording within our trusts is one of the 3 recommendations that has been suggested. I wondered if that had been agreed. So that's the sort of first question. And then the second one is, Em, I don't know if you wanted to say anything else about the new police legislation and whether there's something that we need to do about that as a partnership.
Okay, do you want me to answer first then, Rob? So in terms of dashboards, and it's not perfect, but I think if you wait for perfect, you'll be waiting for a long time. So what we've come to the realisation is we've made a very conscious effort to actually collect the data for all characteristics, actually, ethnicity, gender, sexuality, etc. We're probably further on with ethnicity. And what we've been able to do so far, I mean, we like many of you, we have our own basically board committee that focuses on equality, engagement, involvement. And we've got a dashboard that goes there that uses a whole range of metrics just to identify the differences between, I guess, people accessing services from different ethnic backgrounds, deprivations, etc. We are using it within we have a subcommittee as well, which really consists of a whole range of people from across the trust. And again, it's a little bit like Sarah was saying, I'm not going to pretend that we've got things right yet, but we're hopefully trying to use the data to identify where people are accessing services and where they're not, which particular services are actually seeing a change and which aren't. So I'm happy to share the dashboards actually with anybody that wants to see them. They're being used to provoke discussion and hopefully develop some change. I say I wouldn't say that they're perfect yet, but certainly it's something we've set up with the intention of at least using the data that we do have to the best possible effect.
So is the intention that if everybody's recording the ethnicity, I'm sorry, is that definitely an agreement now? And if that's the intention, will dashboards like yours be used by all providers across West Yorkshire?
So, I mean, we record all ethnicity as far as we can do. I think we've got, 97, 98% rate of recording ethnicity. So it's probably as high as we're going to get it in the short term. I'd say more than happy to share the dashboards that we use. We've got them for waiting lists, we've got them for referrals, etc.
Thank you. Liz?
Thanks, Councillor Swift, and thanks for such a comprehensive report. It's great to see everything that's going on, and I think noting what Sarah said about this is going to take a long time for us to get the results we want to see, but that's no reason not to do it and not to put lots of effort into it. So I was really pleased to see the Improving Population Health Fellowships are from every place. In Kirklees, we've really strived to reach out when the new scheme came out to attract applicants, to approach people. So it would be great to think about how we could support those people in place, as well as them being part of the wider scheme. And I'm asking this from our position as chair. Maybe that you all know this and some things come out that I haven't seen, but I think it would be great if we could see that and we could think about that in the committee, how we provide support and how we encourage future cohorts as well.
Thanks, Liz. I'm going to bring Hannah in as well and then go back to Fatima.
Yeah, just to really support this work, it sounds excellent. I suppose, particularly in light of what Fatima said at the end, and in light of recent discussions we've had within Leeds around challenges around finances and priorities, I think that leadership from West Yorkshire around inequalities is really important and vital, and has to be. But there's something around taking all that learning, so the fellowship and all the learning from this programme, but all the learning of all the insight that people and communities have shared with us for a long time around what can work and what needs to change. It's something about making that, building that into business as usual. And it not being a sort of a side project, but actually this is how we're going to transform our health and care system and meet the needs in terms of inequalities across West Yorkshire. So and then linked to that, it's just what we measure. And I'm just thinking particularly on the Integrated Care Board around inequalities. What are those measurements that we're going to measure around progress around this? So it's I suppose there's something around making all this business as usual in terms of how we meet the needs of the people of West Yorkshire, and then as an ICB, how we measure that.
Thank you. Emmeline.
Yeah, so just coming in on what Rob said around the new police legislation, and I've noted that Sarah said in the chat that things have been put in place for it. So as part of the criminal justice mental health group, which has just been recently re-established and is jointly being run by myself and Simon Jessup from the police and crime team, we're looking at the Right Care, Right Person legislation, which is currently being delivered by Humberside Police and is being seen as good practice to be rolled out across the country. It's about ensuring that when the police are called, that people are getting the right service that's right for them. So often police are asked to do lots of things that are probably beyond the role of an officer and should be dealt with by other parts of the system. So what we're doing within the criminal justice and mental health group is we're looking at the pathways, we're looking at what already exists, what the call outs are for, and how police normally handle them, and where the gaps might be when Right Care, Right Person comes into place, because it may be that they say, well, we're no longer going to respond to this kind of call because actually that wouldn't be the right thing for that person at that time. So we're doing a mapping process to look at how the policy is going to impact on practice and where we might be able to mitigate some of the unintended consequences of that. I think West Yorkshire Police have been doing this approach for quite a while. I think they probably had some insight into and supported the rollout in Humberside as well. So they're in a really good place to roll this out. And we just want to make sure that we mitigate any harm that might be unintended as a consequence of the document.
Thank you very much, Emmeline. Thank you. That's been a thorough review and a good debate. Fatima, is there anything you want to come back on
briefly?
The next item?
Thank you. I mean, part of what some of the feedback that we've just heard, Chair, will be covered in the second item about how we ensure that the lens of inclusivity is part of our decision making. But what I will say, and Michael Crowther put it in the chat, and I think it's really important, if we're not keeping score, we're only practicing. I do really think there is something about the balance between sort of making sure we've got the right outcomes that we're focusing on as an organisation when it comes to equality, diversity and inclusion. And I also really appreciated Liz's suggestion about the role of place within this. I think one of the key elements that I'd like to pick up as part of this review is how we strengthen the leadership of place on this agenda. And I'd really appreciate a chat with you, Liz. I know we've been trying to do it for quite a while, haven't we? But it'd be great to set up a chat to see how we could do that with any other place chairs as well, if that's okay.
Thank you. Kenise?
I just have one last thought, and I've been trying to look at all the chats, and I agree with Rachel about the Irish community too. I'm just really worried about the level of trust that we've built up over since COVID within our forest community. Slowly and surely, everybody's worked really hard on that, and now that we know that we're going to have to tighten the purse strings, what's going to happen to all that work? Are we going to take it all back 15, 20 years again? So I'm really concerned about that, and we are really concerned about that. So I just wanted to make sure that that was like noted at the end.
Thank you. Yes, definitely is. Okay, thank you. So not seeing any more items on that one. So thank you. We will note the progress and our continued support for those activities, and move on to the data insights item. And again, Fatima, can I ask you to introduce your colleagues and lead off on this?
My apologies, Chair. I think colleagues on the partnership board are going to get really sick of the sound of my voice by the end of the afternoon. So can I introduce two new colleagues? One is Hayden Ridsdale, who you've heard about before, did that fantastic dentistry paper. He's one of our programme managers here in the Integrated Care Board, and Jonathan Booker, who was the Associate Director for Analytics and Analytical Services, my apologies, here in the ICB as well. So I'm going to pass over to Hayden to do the intro, if that's all right. Over to you, Hayden.
Thanks, Fatima, and hopefully everyone can hear me. I've been having a tricky time with my technology today. So I guess to kick off really with a bit of an overview of what Jonathan will get into the detail of and Fatima will sort of wrap up with, I do think it's really important that when we're talking about this topic and the topic of sort of workforce race equality and inequalities, that we do recognise, and the paper's tried to be clear on this, that we have got form on this conversation in West Yorkshire. The preceding conversation is a perfect example of that, and so are the preceding ones that I was a part of for the best part of 12 months or so, around 2 years ago. And I think really what this paper tries to do, and hopefully this conversation and conversations that come out of this will continue to try and do, is bring together that commitment and that form with the sort of mantra of being data and evidence driven. I think that's really important, and so that we can continue to have a conversation on a level that is informed by empirical data about this matter really. And I think so what the paper does really in order to be able to do this is use the best evidence that we've got available to indicate sort of where we've gotten to based on some of the work that's been done and what the current state of play is, to highlight within that where there is sort of been progress and there are good practice examples that perhaps there's scope to explore, to scale up, to learn from as a collaborative system, but also show why the commitment that we've made some time ago remains to be important, and highlight where there may well be scope for improvements and further action either as individual partners or collective action there. I think it's really important that from a sort of more methodological perspective, we do note a few things when we're talking about the data within this paper that Jonathan will go over. And I think there are probably three things when we talk about the data. One is that the paper reflects far more data and in far greater detail than we'll be able to cover in a short 20-minute agenda item. So for colleagues that do want more detail, it is available there in the paper. The second is that we've worked and we tried hard to make the data representative of the totality of partners within our health and care partnership, and I think there was sort of mentioned earlier on in the agenda of an open letter written by the chair of the ICB board, Kathy, but despite that we didn't receive returns that pose sort of additional data to that which is already publicly available, so we've got some challenges there. And the third thing around the sort of data is that partly as a result of that, but also more contextual factors, it is quite NHS centric, and even within that, quite trust centric. So I think it's important that we note that. And I suppose final point as a brief summary, and this is what Jonathan will start to get into. I think what we do see overall is that there's still a significant shift that's required. I think I've heard conversations today that probably appreciate that already. But pockets of positive trends, I suppose, which is also really important. I think it's important we maintain that positive lens where it is possible. And so it's important that we're still committed to these conversations that we've been having. But also important, I think, that within that we do recognise the complexity and the context around it, whether that's sort of data quality that I've just outlined, or whether it's some of the other things that have been outlined already, such as we're really going against the grain of decades and decades upon decades of injustice and racism. I think that's important, and recognise also that the actions proposed at the end of the paper and that Fatima will shortly outline are solution focused and intended to be collaborative. So Jonathan, I'll continue to drive the slides for you, and I'll move on when it feels good to do so, but prompt me if you need to.
Thanks very much, Hayden. Hi, everyone. Apologies for the slightly gravelly voice. I've been struck down with the dreaded lurgy, so apologies for that. So do you want to skip on to the first data slide? Thanks very much, Hayden. So like Hayden said, this is a kind of subset of the data that was included in the paper, and this first slide just gives an overview of the ethnicity in clinical and non-clinical areas, and it kind of shows you in each of the two groups of graphs, top left, excuse me, the top left graph is support, then the top right is middle grades, which is bands 5 to 7, the bottom right is more senior, so 8 and 9, and then the bottom right graph is the VSM, and it's showing the proportion of staff from ethnic minority backgrounds. that are in our workforces in each trust, and basically the height of the bar relates to the proportion of staff in that particular grouping. And as you can see, basically the story is that the further up the seniority ranks we go, the less people we have from ethnic minority backgrounds represented in our workforce. It becomes kind of much more noisy when we look at the VSM slices through, because obviously the law of small numbers kicks in there, and so the proportions kind of bounce up and down quite a lot. But it's very noticeable that you've got far more people from ethnic minorities in support levels, and then it just progressively decreases. The 3 bars for each trust represent 2020, 21 and 22. So we can see there's some variation. Could we say that there's a material improvement? I don't think we necessarily can, but we can definitely see that the trend is kind of as it has been over time, really. So that's that one. Do you want to skip on to the next one, please, Hayden? Thank you. So this slide is, excuse me, shows for 21 and 22. They're the 2 sets of graphs on there. A comparison between the overall ethnicity breakdown for the workforce in each trust, which is the light blue bar on the left for each organisation, and the breakdown, what proportions of non-exec and exec board members are from ethnic minorities. So you can see there's quite a lot of variation. There's not much variation over the last couple of years, but there are some organisations where excuse me, we've got some change going on, but it's predominantly kind of as it has been, really, unfortunately. Do you want to skip to the next one, Aidan? Thank you. So this graph slightly different. So this shows the 3 years from 2020 to 22 for each trust. Excuse me. And what it's showing is the relative likelihood of people going from the shortlisting stage to actually being appointed into a role. So where the bars on the graph are above the dotted line, that means that white staff are more likely to be appointed than staff from ethnic minority backgrounds. So you can see there's a kind of a notable exception in Leeds Community there, where they've consistently for the past few years been bucking the trend of the remainder of our organisations, NHS organisations, I must say there. And there's some slight noise in some of the other ones. So kind of one of the points that I think we'll come to in terms of recommendations from this paper about getting together a group to understand kind of what underpins the data quality, etc., I think would be really helpful. If you look at Bradford District and LYPFT there's kind of a distinct up and down in terms of the proportions. Is that a factor that relates to the pandemic? Is it a data issue? You know, we're not sure off the top of our heads as things stand at the moment. So some clarity on that going forward would be really helpful. But we've still got a situation where basically white staff are much more likely to be appointed based on the data that we've got compared with staff from ethnic minority backgrounds. Thanks, Hayden. Could you skip to the next one? So I tried to bring together a couple of measures from the staff survey to enable us to look at kind of overall experience. So this is the proportion of staff that experience either harassment, bullying or abuse from other staff and colleagues. The graph in the bottom left relates to the ICB itself as an organisation, because we can't break it out in any other way. Within the ICB, it says that nearly 13% of white staff have experienced such behaviours, and for other ethnic groups, it's 17.4%. The top right hand, excuse me, graphs show for West Yorkshire as a whole, and then for each trust. So there's the national results in the line graph at the very top left, and you can see that West Yorkshire kind of mirrors that pretty much in terms of the proportions and the trend, where fundamentally ethnic minority staff experience this much more often. And we can see the breakdown between ethnic minority and white British staff for each of our organisations. The largest gap out of any of our trusts is 10%. But when we're dealing with numbers of kind of between 10 and 15% for white staff and up to 10% more than that for ethnic minority staff, that's clearly giving us a pretty clear picture. Do you want to skip on to the next one, Aidan, please? Thank you. And so, again, similarly for this one, this is for the ICB as an organisation. The graph at the top right shows the whether staff believe that the organisation offers equal opportunities for career progression, where for white staff in West Yorkshire ICB is just over 67%, and for other ethnic groups it's just over 38%. And then we've got a relative likelihood graph for each individual trust here for the years 2020 to 2022, where if the bar is above the dotted line, basically staff from ethnic minorities are more likely to enter a formal disciplinary process. Excuse me. So we can see there that basically the vast majority of those bars are materially above the dotted line, which means that unfortunately staff from ethnic minority backgrounds are materially more likely to enter a formal disciplinary process based on this data. So that's just kind of a quick overview. Don't want to take up too much of your time getting into the detail with it, but it's giving us a very distinct picture based on the information that trusts are providing to us, which is really helpful so we can see what's going on. But I think it sends quite a definite picture for us to consider. So
Jonathan, before we go to the next steps, Rob's put a question in the chat, and I know you're hanging on to your voice by a thread, but I'm really keen that you answer this one. So on success from shortlisting, I suspect there is a tolerance around a ratio of 1 that would suggest there is an equal chance. Do we know what this is? Is it a +/- 0.1? It would just be helpful for you to maybe clarify that in the chat, or if you're able to verbally say so, answer the question.
Yeah, you're right, Rob. Yeah, there will be statistically. What's the likelihood? So that's what you're getting at. But yeah, shall I pick that up and come back to you?
Yeah, I just think it's important for us in all of these things to understand, because sometimes there'll be some small numbers and sometimes there's some quite big numbers. So on the face of it, my suspicion is that for success from shortlisting, CHFT is probably equal, because it's around 1, hovers around 1, doesn't it? If not quite 1. But others where you're 30, 40, 50, 100% more likely, it's definitely different. So I think some of these things matter in terms of the scale. I also think, just while I've got the microphone, that we in the ICB, we did some work around different ethnic groups within the other category, and this is one of the reasons why we need to think about the term BAME, for example, because there are different experiences depending upon different ethnic groups. So we know within West Yorkshire ICB that the experience of people from Pakistani, Black African, Black Caribbean, Bangladeshi and Indian heritage is different and more positive in some of those groups than others. We particularly find that people from Black Caribbean and Black African groups have the worst experiences. So I think there's something about us making sure we go further into the detail where we need to find out what's really going on.
So before we open it to questions, shall we just go on to the next slide and then we'll open it up too, because there's some comments in the chat as well. So I think it's really, really important to acknowledge that as a partnership, we have been really courageous when it comes to our overt focus on addressing inequalities from an ethnicity perspective. We've also, and we've said this already in the partnership board meeting several times, can't address systemic inequalities that have happened for generations in a decade, in a matter of months, although we're doing our best to do so. We've also acknowledged, and Rob's just again brought that point forward, that the data is only as good as the data that goes in. And sometimes the way in which we distill that, or the lenses by which we look at it, can identify certain trends. And it's really important that we continue to do that, which is why the Ask for Data is so important. And we've got some great work and some already on organisations that we've highlighted that are doing some great stuff that we can share with other colleagues to ensure that we're spreading that good practice, because that is part of the reason why the partnership exists in the first place. However, there are some improvements, as we've just discussed and as Jonathan's just shared. And I think it's really important that we continue with our commitment to share high quality information when it comes to ethnicity. This is really, really important for us to be able to identify where the interventions are needed. And even when we're talking about the global majority or ethnicity as a whole, as Rob's just demonstrated beautifully, not all BAME is the same. So we need to get a little bit more sophisticated when it comes to our data analysis to really focus on what interventions are needed and where. We would also really like to reiterate the importance of encouraging our non-NHS colleagues to share data with us as well against the indicators that we've just shared. Now, I know that they're not all the same, but I think for us to collectively work together on this agenda, it's really important that we're able to make the interventions based on the evidence. And at the moment, we've got some significant gaps in our evidence. And also, where possible, if we can have a contact that holds responsibility and ownership of this data for us, that would really support the forward way of working, particularly for myself as inclusivity champion, but other colleagues that are working on this too, to make sure that the data is accurate. And you know, whenever we talk about data, it's always an interesting discussion because people are interested in it, but the data is only as good as the data that you put in. So anything we can do to support that would be great. Another area that we think would really add value is developing a community of practice space. So we've already done this in a number of other areas, and I think this is something that we need to continue to do. But as a system of equal partners, we need to make sure that the evidence reflects the rhetoric and the commitment. And right now, as Jonathan's presented, there are some significant areas for improvement. So I'm going to just pause there with the equal caveat that there's a really good time right now with my window of starting as the inclusivity champion for this data to really support how I can influence this collectively across health and care as well as our local government partners. So I'd really appreciate some insights and thoughts on that too. So I'll pause there, Chair, and pass back to you for any questions or reflections.
Thank you, Fatima. Yeah, Jennifer Connolly.
Hi, thanks, and apologies to dwell on the data point, but it's fantastic to see the data presented at this level already. I think that's really, really positive and helpful to be able to understand some of the patterns that we're seeing. I think just it picks up on Rob's point to some extent. I think it'd be really useful to understand the sort of numbers that we're dealing with, so we get an idea of kind of what that variation might look like, or what we might expect that variation to look like with it between years. But then I was really struck by the data that's presented under some of the so the staff believing that the organisation provides equal opportunities for career progression or promotion, and then also the discrimination from a manager. When you look at the numbers of responses, the difference in sort of size of response, the numbers of responses you're getting from white staff versus other ethnic groups, it'd be really helpful to understand if that sort of level of response reflects the workforce, the pattern of the workforce, and does that pattern of the workforce reflect the population? So it's kind of understanding at every level how different where we're not getting voices, where we're not getting responses, and therefore how we can then interpret the data that we are seeing. So I just think it'd be really helpful to go that one step further and give us that idea of you know, how that reflects against the total workforce. So are we getting the same proportion of responders from different ethnic groups? And then just picking up on a point that Brendan made in the chat, it's looking at then who are we not hearing from, who are we not shortlisting, who are we not appointing, so on, and what we can learn from that. So I think those 2 points sort of go hand in hand, but thank you very much for sharing this.
Thank you. Rob?
Not to get into a complete geek off here with Jen, I think we did, over the years we've been doing the staff survey, I think if you look at the responses from people who don't declare protected characteristics, they tend to be more negative, and I think that's partly confounds some of the results, but also reinforces the fact that it's a problem. I think also as an ICS and ICB, we've done some work, haven't we, in terms of our processes around shortlisting, getting diverse shortlists, getting people appointed and recruited, and worked with people afterwards, so we can feed some of that into this work. But ultimately, in all of this, we need to go back to not admiring the problem, but addressing it.
Thank you, Rob. Rachel?
Yeah, so firstly, apologies from local government that we didn't contribute to the data in this. I will endeavour to find out why. It may just be, as you know, in terms of capacity to answer questions, where if we don't hold the data in exactly the right form, it might have just been something that we weren't able to do in that time. But what I think hopefully we can offer in return is that we also have an awful lot of population level data that we hold in local authorities about local population that also may help to set some of the context for this data. And so I think the workforce data is really good. But I also think then if we look at it in context of population level data, and particularly as the latest census data is now all available, it's probably at its most useful at this time before it gets any older. So hopefully we can redeem ourselves by doing our homework and then providing some extra support to this. So I'll follow up with you on that.
Thanks, Rachel. Kathy?
Thank you. I suppose there are a few points. It's going back to the previous agenda item and Kinese's point on sharing practice, pinching ideas from each other. So I really welcome how case studies are coming through the last item and encouragement through this item as well. At a previous meeting of the partnership, we talked about the use of the inclusive recruitment toolkit. I think it'd be great to hear more stories on how people are using that effectively. And if you're not, what help do you need and what information do you need from the team? That would be really welcomed. As anything with data, and colleagues have talked about this already, but I hope that as you sit and read the data, and I remember us doing this back in March 2020 when we looked at this kind of data, I hope that everyone has the chance to go back and check it, and if it's not true, to correct it, or if they haven't provided everything, to provide that information. And if we need to update that data pack, Tim, perhaps we can then republish it on our website as we do alongside all the other meeting papers. So I don't know if HR directors and company secretaries might want to go back and look over that. And Rachel, that's really helpful to hear about local authority data coming forward as well. Two other points for me. One is on the non-exec side. So for me as a chair, it's really helpful to see the board data. And for me, that connects well with the messenger review, which you know, Dennis Pollard, chair at Leeds Teaching Hospital, was involved with nationally. And it links back to two of the recommendations there on making sure that we are proactively taking action on equality, diversity, inclusion, and also growing our non-exec and board community. And a few West Yorkshire chairs got together this morning just to look specifically at that topic, how we retain talent, how we attract the next generation of non-execs and chairs. So I think there's a piece of work that we talked through this morning as some of us as chairs that can complement this work as well, Fatima. And the last point, I suppose, is it's really sad to see the discrimination that colleagues are facing in the workplace. And I wonder what more we can do with our Root Out Racism campaign, a refresher, a reminder, the next stage, because it's the whole point of the campaign, as well as it's hard to see those statistics because there's a person behind every single one of them. So what more could we do around that as well? Thank you.
Thanks very much, Kathy. Fatima, do you want to respond to the?
I mean, I've never been known to disagree with Kathy. I completely agree with everything she said. I was just going to say that there is a member from the West Yorkshire Strategic Race Equality Network who leads this particular work stream. Her name's Zahida Mallard. I just wondered if we could bring her in for some brief reflections because she's done a lot of work on this.
Thank you, Fatima. Thank you for the invite to the table. I just want to say that data and behind data, as Kathy said, are individuals, and at the Strategic Race Equality Network, we hear from individuals about the impact of working within the system has on them as individuals and how that then ripples out into their community, whether it's a bigger community or a smaller community from the global majority heritage world. And I think we talk the talk a lot, and I know that my previous chief exec and my current one, that both in this space have heard me say words and actions, and for too long we have had too many words, too many reports written, too many experiences. But the action that follows it throughout the system, whether you're a band 2 worker whether you're a very senior manager in the organisation, whether you're an elected member or whether you're a director or a council officer, it cuts all the way through. And therefore we need to continue to work on this and not just put a whole load of recommendations that we've ticked, but then not follow through of them consistently. We aren't going to get rid, I say in trading, the ists and isms of the world, but we can make a go at challenging and progressing. I'll probably stop there because I could carry on forever.
Oh, thank you very much. It's really powerful and really appreciate it, Zahida. Thank you. So can we endorse the actions and recommendations that are set out there? Oh, Rob, sorry.
So I think so I was just going to pick up on what Zahida says, and as we get into endorsing the actions, I would say that as you know, Zahida has always been rightly challenging, and I've always encouraged Zahida and her colleagues to be, challenging of progress. And I'm pleased to see that my former trust and Mark's current trust is doing quite well on some things that we set out to try and tackle. I know that Brodie and Thea will have set out to tackle some of the issues that they've tackled in LCH. We can see from CHFT that they've done some stuff to tackle. So you can, with the right leadership and with the right actions, make a difference and make change. I think what I'm quite interested in is we haven't had any information from third sector or local authority colleagues on this. And we've known that in the NHS that there's been a problem for a while. We've always known it's a problem, and we started doing something about it, measuring it properly for several years, and we haven't made enough progress yet. So I'm quite interested in if we haven't got the data, what do leaders in local government and the third sector think's happening? And is it a problem for them as much as it's a problem that we see persisting in the NHS? And as we endorse the actions, are we taking a leadership stance here, which allows us to do something about it?
Thanks, Rob. I've got Philip Marshall and then Anthony Cook.
Yeah, thanks very much indeed. I'm just responding to Rob's point there about following through on the data, and I don't profess for 1 minute that Mid Yorkshire Trust has all the answers, but I think it is about the creation of psychologically safe workspaces, and here we've found some success with appointing each of our executive directors as a champion for protected characteristics and a champion at board level to really start to set the tone. And then I think the other thing is just absolutely getting into the detail of your own workforce race equality standard results and your workforce disability equality standard results, because if you get into that at a granular level, you can start to identify where some of the challenges that you might face within the workplace are. And having active networks for all protected characteristics is a way then that you can use that data and understand people's lived experiences. And let's be clear, where people have been involved in disciplinary matters, why is that from all staff groups? What's led to that? And just trying to identify any trends as we seek to try and get that downward trajectory. So there are a lot of things taking place, but I do agree we've got to take the action, and Cultural Ambassadors here has been really successful, has reciprocal mentoring. So there are plenty of initiatives that we can really do to engage and create great workplaces, but getting into that data and understanding where we have got higher than average scores is a critical first step. So I do agree with what you just said there, Rob. Thank you.
Thank you. Anthony?
Yeah, thanks, Chair. And just in relation to the point about local government and whether this has sufficient priority at the moment, it absolutely does. There's no question, certainly that in Leeds we've been doing a huge amount of work on this over the last couple of years. I know John Ebo was on the call. He's done a brilliant job in leading a huge number of conversations across all levels of management in Leeds City Council, and inevitably it has brought up some of the same issues that have been discussed about performance, retention, and in particularly recruitment and where and how we recruit from communities, which I think is a key issue. And even in some of the highest performing teams, there are often issues that have surfaced as a result of these conversations. I think it would make sense, obviously, in terms of looking at the data. We have a huge amount in Leeds from a regular staff survey that's done every year, just to align some conversations with NHS colleagues and make sure we're looking at the data in the same way, and that we're able to compare and contrast what's going on and in fact learn from each other's best practice as well. And I think the conversation, I won't jump the gun, but that we probably come into a little bit later around health inequality
and the wider determinants of health as well. I think it's really important that that connection between the EDI world and the world of public health and health inequalities is further strengthened, so we can make progress on both of them at the same time. The issues are hugely interconnected, as we know.
Thank you, Anthony. Kim.
Thanks, Chair. My name's Kim Shuttler. I'm the VCSE lead on the ICB and the SRO for harnessing the power of communities. I also have a day job as Chief Exec of a charity in Bradford. I think capturing the data for the sector will be a challenge. We do have a report coming out very shortly, which is an updated report on the state of the sector, which we commission alongside the combined authority to look at the state of the sector. And I believe, to trail that, there's some useful data around this, which does highlight West Yorkshire as a bit of ahead of the game in terms of the diversity of its staff. That said, what I'd say is I think we have a very mixed picture in terms of our sector. We have the fantastic grassroots diverse organisations, which and the beauty is that their diversity. I'd highlight that those are the organisations that we continue to talk about at being the most at risk at the moment in terms of sustainability, and then we have a really mixed picture, I would take a guess, but the challenge is therefore in addressing that is what we don't have is the infrastructure, the resource, the teams to do the real hard work, really meaningful, sustained hard work that it is required to make a difference and not just tick a box. So, and I know that because it's my day job to do that. The amount of money and effort and infrastructure and ongoing learning and challenge that we have to give ourselves as an organisation to do it. And we would be classified in year 5% largest organisations. So you've got other organisations like Touchstone in Leeds who are absolutely exemplary, big infrastructure to do that, strong expertise. So I would love to see a day where that there was an opportunity to have that infrastructure to support smaller organisations who don't have that, to have that lens and that expertise to really look at them organisationally. Obviously with resourcing, that's the big challenge. So a big priority for our sector as well, I think. But yeah, capturing the data could be a little tricky.
Thank you, Kim. I've got Johnny Bow and then Karen Jackson, and then Fred really will have to move us on to the next item. John.
Yeah, thank you, Councillor Swift. Tony has stolen my thunder, so I didn't give you any money, Tony, but thank you for that recognition of the work we're doing in Leeds. I was going to answer Rob's question directly, really, and I think the truth, Rob, is that we have good intent, but there's quite a way to go yet. Lots of work going on, and like anything else, it's constant. It isn't about today or tomorrow. It has to be part of the everyday, and that's the challenge. How do you make this value-based stuff as easy as thinking about finance, as easy as thinking about, how you manage your budgets, how you manage your projects? It's got to be that simple, and getting that message across 15,000 people isn't easy. And we accept, in the second largest council in the country behind Birmingham, that with 15,000 staff, you're not going to get 100% good experience for everybody. But having said that, the proof of the pudding is that lived experience. All this work, all the strategy, all the policies, is it making a difference to people, on the shop front? And that still remains a challenge, in honesty. But we're doing a sort of culture change in organization. It's not a training program. Then we can send you on a course to do that. It's about hearts and mind. It's about inclusive leadership. It's about what this means in terms of our outcomes. So we're on a journey. It's the actual truth, and I think we're slowly getting there, but there's a long way to go.
Thank you, John. And Karen.
Thank you. I suppose I'm going to reiterate a bit what people have said, but to say from a social enterprise point of view, we definitely have got this data. It's telling us we need to do a lot more work in this space, and we're really grateful for the support people like Fatima and the team are giving us. But I just wanted to say we do have it, so perhaps we need to do a bit of a chat with Jonathan to see how we get that onto the right page. Thank you.
Thanks very much, Karen. And I noticed the recommendation specifically pick up that question of data not being in the same format and encouraging people to provide it in the simplest thing. So thank you very much, everyone, for your contributions and for that presentation. I'm taking we will endorse the suggested actions in that report. So thank you. And move on to item 10, which is the work on developing a partnership agreement with the combined authority. And I think Ian and Rachel, you're going to introduce this item.
Yeah, I'll let Rachel introduce this one, but just really quickly before she does, sorry, Rachel, can I just introduce Alan Rees from the Combined Authority, who's joined us as part of the conversation as well. Over to you, Rachel.
Fantastic. So you've got the draft partnership agreement wording in front of you in the papers, but there's probably just a few things that we wanted to say about it. So I think the first one is this is not a new relationship. This is an ongoing relationship, but we are in a new phase of our organisation. So the Combined Authority became a mayoral authority almost 2 years ago now, and the ICB became a statutory body a year ago. So there's something about having those statutory relationships backed up with something written down, and that was part of the emphasis of doing this. There's not been an agenda item today that hasn't talked about that inextricable link between people's lives and people's well-being, between health and wealth, and so it makes it just the most obvious thing that we would do is the two regional bodies charged with and trusted by the people of West Yorkshire to deal with health and wealth should work together to make it better for everyone. And I think there's a line in the document that was talking about being a region that understands and invests in lifetime health, because we recognise that is not just good for people's well-being, it is good for the economy, it is good for everyone that we've got that level of understanding of what that really means, but also backed up with the financial decisions that we're all taking to do that. So you'll see in there we've chosen 4 priorities, which are all really big. But really specifically included because, particularly around economic opportunity, we think that we've got a really unique chance here in West Yorkshire to improve productivity by improving people's well-being, and we know that that's something that our region lags behind in the national economy. The well-being of people in West Yorkshire contributes to lower regional productivity. But we also have some natural assets, not least of which having large proportions of our National Health Service and the health tech sector and the health science sector based here in West Yorkshire. So we think we've got some natural advantages there. So we think that we get that double whammy of working together on improving, and this increases the well-being of the region, but also increases our productivity and our economic prosperity and economic opportunity for people. Similarly, with climate emergency, we think it's imperative that we do the hard work of making our region as climate secure as it possibly can be. It doesn't take, we don't have to look very far to see the direct impact that climate change is having already in West Yorkshire, and Calderdale in particular would testify to that. But also, we also have, again, a natural advantage of in terms of climate preparedness, that we may be able to contribute to not just the mitigation but actually opportunities and innovations in tackling climate emergency and in tackling the health impacts of climate emergency here, if we work together, if we invest in the right things and work in the right ways. The equality, diversity, inclusion priority, again, it could go without saying, but as we've just seen in the last 2 agenda items, there is a significant amount of work yet to be done. And I think work is exactly it. It's not just intention. We need to change the ways that we are tackling discrimination and removing those structural inequalities for people in West Yorkshire. And lastly, it's a catch-all, but the social determinants of health, those factors that determine health, are things that we can work on, and if we use the kind of subsidiarity approach really intelligently, things like where people work, the homes they live in, the creativity and the cultural offer that they're exposed to, all of these can contribute both to people's increased well-being and the overall regional productivity. So all of that is the reason why we should work together. The ways that we've chosen to work together is we've got some joint posts. So I've been in posts for quite some time. You heard from Em earlier in the meeting around the work that she's doing with the Violence Reduction Unit. And then more recently, we've taken the decision to create 2 new joint posts. And I think you'll hear more from both Fatima and Jen about those posts and what that can do around the social determinants of health, but also about the inclusivity aspects of it shortly. But we want to recognise by saying, yes, there are joint appointments. Yes, there are reasons why we should have people who work across our organisations, but that's not the only ways that we would work together. We work together through opportunities where shared capacity might be effective or cost effective. It might be joint campaigns, it might be joint projects. So, we're starting here, but the partnership agreement is very much about where this takes us. And again, using one of Myron's maxims, start somewhere and follow it everywhere, I think is very much going to be a part of our ongoing dynamic partnership. Then lastly, you'll note the draft nature of this document means that we haven't yet said which boards we would like to have representative from this board on in the combined authority, but we feel that it would be appropriate now to include the mayor and a chief executive or chief executive's representative of the combined authority into this partnership board, given our very vast overlapping and shared agenda. So when we have those discussions and the combined authority is changing some of its boards at the moment, it's not that we don't agree that should be happening. It's just that we haven't got the specifics of which boards that should happen in. So I hope that gives you a flavour of what's in the partnership agreement, the reason why it's there, and in some ways it's something that it could have happened ages ago. In terms of, we've been working together for a long time. It's something that could have happened, we could have written down. But the meaning isn't what's written on the paper. The meaning is the work that we will do as a result of it. And I think as evidenced throughout this agenda, that's already in place and that's already ongoing. I don't know if Alan or Ian want to add anything to that.
Thank you, Rachel. Ian, Alan, anything?
Yeah, if I could, thank you, Councillor Swift. Yeah, thanks very much to Rachel for introducing and just to endorse everything that she's said. We have a paper coming on the next item on the agenda, which follows on really nicely from this, from Jen and Fatima. I guess what I'm about to say could be an intro to that paper as well, which is that the combined authority recognises that the combined authority is not responsible for delivering health services or providing health services, but everything that the combined authority does in one way or another will impact on the population's health and will impact on inequalities across West Yorkshire, whether that is work on a clean, sustainable, affordable, accessible transport system, or encouraging new businesses to grow and create good jobs, or enabling people to develop new skills, or building affordable, sustainable, clean homes, or ensuring that there's a police service which is inclusive and keeps people safe in West Yorkshire. Everything that combined authority does in some way impacts on the health of the population. The question for us is, how can we harness what we do in order to help deliver positive outcomes in terms of health and inclusion, and recognise that those ambitions are shared across the combined authority and across the health and care partnership. So really welcome this piece of work that's been done. As Rachel said, it is it's near final, but here still in draft for comments before then finally approved. And the idea will be as well that we take this through similar governance structures in the CA so that it's signed off at the combined authority side as well. Thank you.
Thanks very much, Alan. So obviously there is a connection between this and the next item, but can I just check first of all if there's any comments or views on the draft agreement? Are people broadly happy with the direction of travel? Yes, James.
Yeah, no, thanks, Councillor Swift. And thanks for those who've been involved with this. My comment, I completely agree with the approach and what has been said already. I suppose my comment, and it was just for thoughts, and I know it comes up in the next paper, so I'm slightly. I didn't know whether to bring up now or the next item, but is around research, and should it be kind of linked or noted in this? I appreciate that comes under maybe some of the joint and shared appointments that has been mentioned, but we talk about where do we come together and harness kind of to come together about planning and delivery of policy, and research should be driving policy. So I was just wondering whether or not we should kind of mention it. I know it's mentioned about our universities in paragraph 40 in the next item, so I don't know whether it's kind of linked there and it's picked up there, or whether we should actually kind of put it in this document here, because I know there are discussions also about how we can bring together kind of research across the WIRA and WICA and the ICB. So it's just whether we should a nod to it or not, and happy to take comments.
Thanks, James. Alan or Rachel, do you want to respond to that, or shall I bring Jen in next?
I think Jen's well placed to respond to that question.
Thanks, Jen.
Yeah.
Thanks. I was just going to say, yeah, I think that's a good shout. We could make that explicit reference, because we've already got a mechanism in place with the intention around the West Yorkshire Scientific Advisory Group to help us with that. So I think that there's kind of thinking around how we would best deliver on that already underway. So I think making something explicit, as Rachel set out, this is about kind of the way we're going to work together with the big sort of strategic aims, and research will inevitably and rightly be a good part of that. So I think we could definitely put something explicitly in there.
Thank you, Jen. Kathy and then Rachel.
Thank you. I suppose I wanted to reflect that outside of West Yorkshire, there are other systems that work very closely with their combined authority. It seems it's quite interesting that they operate primarily over the north of England, but we also have an example in Birmingham as well. And I think as we are, and Rachel talked through this earlier, we've got a combined authority in the first few years, ICB that's only just about a year old, that I think what we can do is compare and contrast like we do on lots of other things on how that works, but we need to make it work for West Yorkshire. And I know that it's very explicit in the paper, but we are inviting in Mayor Tracy Braben and the Chief Exec of the Combined Authority into our partnership. And as Rachel then said, then we need to define who would come in and be part of their work. And what Rob and I and Ian and Alan and others can do, particularly in working with Jen, is then learn how other places like Cheshire and Merseyside and Greater Manchester and South Yorkshire and Birmingham are doing it as well, to make sure that we learn. But we've got a great foundation here to build on of many years' work. So I really welcome this memorandum of understanding. I think it's great. And then, as a number of you know, what we're building on from there is, because we have such well-established systems across the north of England, we are exploring a Northern Alliance at the moment, and that's coming in different ways. Fatima is connecting with people that do her role. Ian is connecting with people who's doing his strategy role, and we aim to align together on common things, which goes back to the earlier points colleagues have made today on lobbying. What do we need for West Yorkshire? What do we need for the north of England, particularly because we operate as 7 very strong, well-established systems, as well as our success and award-winning system and partnership that we have here in West Yorkshire. So I just wanted to share that, Tim, and I hope we can bring some information on ways of working across the north, perhaps towards the end of this calendar year, as well as is outlined in a paper later for our September meeting in person. And I hope that's when we bring in further the combined authority as well.
Thank you, Kathy. Rachel?
Yes, I was just going to echo that point around research, but probably just to really put in the frame as well, something that colleagues from Bradford are always very passionate about, which is applied research. So when we talked about these issues before as a partnership, you know, we were really keen that West Yorkshire does become a centre for applied research excellence, and that we want to set out our stall to be a place that that research is invested in, but also that we can apply that research on the ground quickly and get the benefits from it. So I'll adjust the wording in that to reflect that.
Thank you, Rachel. Rebecca.
Thank you, Chair. Just a quick anecdote to support this, really. I don't know if Hannah Davis is still here, but when we did the Big Leads chat, which is where the health and care senior executives meet the public in the market in Leeds to talk about what do you want from your health and care system and be approachable. And my thing I always say is people always say, I want a good bus service. And we're talking about health services and people tell us they want a good bus service. So I just want to really underline that is why we need to do that alignment, and I just really support it. But that's what people tell us.
Thank you. Yes, I've had the same experience. So thank you. So we've had the opportunity to review and comment on some really good and useful points to build into the next stages on taking this forward. Can I move us on to item 11, which does very much link into this, and ask Fatima and Jen to introduce us?
Alan, do you want to say a few words?
And Alan.
Yeah, thanks, Fatima. Yeah, I'm just going to say a couple of words before then Jen and Fatima introduce the paper in more detail. So as I was saying a moment ago in introduction to the previous paper, several points. One, there are a number of shared objectives between the ICS and the combined authority, and we recognise that by working together, there's a significant programme that we can deliver, which would help to deliver both the West Yorkshire Integrated Care Strategy, the plans of the combined authority, and indeed the mayoral pledges. And it's all centred around health and inclusivity, and a recognition that the health of the population and a strong inclusive economy are interlinked and inextricable. And so things like good jobs, good homes, creativity, a good transport system, climate, clean air, etc., all help to contribute towards both improved general health of the population, tackling health inequalities and inequalities more broadly. So this paper is really about the kind of it's the first time that we've tried to pull together a programme of this kind, actually, that kind of sets out and codifies more clearly what the things are that we're going to do together, and it so very clearly builds on the previous paper. Why it's important, I think, is summarised really nicely in paragraphs 6 and 7. Where it talks about how health inequalities are unjust, unfair, unavoidable, deep-rooted, etc., and what then the cost of that is to society. And yet most of those health inequalities are preventable. And then secondly, the point that around 80% of the things that generate and sustain good health are things outside of healthcare, that the combined authority and indeed local authorities have a significant amount of influence over. What we're trying to do through this paper and through the proposed programme is to identify those areas where we can add most value by working together. So important to note that, yes, everything is connected, but what are the key things where we can add most value? And then and finally, I just come back to this point of what we do at the combined authority impacts on health and impacts on inequalities, whether we make a deliberate choice for it to do so or not. So one of the things that Jen will come on to talk about in a moment is the idea of health in all policies. So the combined authority making a conscious step to bring tackling of health inequalities and improved health outcomes into the objectives of the investments that it's making. So that's all I wanted to say by word of introduction, and great to hand over to Jen now, if I can, Councillor Swift. Thank you.
Thank you, Alan. Great intro, and I think it really builds on the previous item as well. So I've been in post, just over 2 months, and I've been incredibly impressed with the work that's already underway across the West Yorkshire region. And I think this really gives us a further opportunity to build on that and to be, as Alan said, explicit in our intentions around activity relating to the social determinants of health and inclusion through the appointment of Fatima as Inclusivity Champion. So we've tried to bring those things together. Alan's giving you the context and the rationale of why. If we go into a little bit more into, okay, so what we're going to do really, there's, to my mind, kind of 3 buckets of stuff that we're going to do. One's around health and inclusion in all policies. So that's been intentional, that's use of data, that's us really thinking about, okay, this economic strategy is going to have a massive impact on people's health. Let's say how, let's say why, and let's say what we're going to do intentionally to improve that equity and impact on health. Then we move into some programme delivery. So the health and inclusion in all policies is about changing the way we work, being explicit and being kind of really upfront with how we measure that impact as well. The programme delivery is the activities and the explicit things, the things we're going to do in the short term and medium term that will actually exemplify some of that health in all policies work. And we know there's some really key areas. Fatima will want to say a little bit more about the sort of equality, diversity and inclusion activities. But if I just touch on 3 where I'll be taking more of a lead, that will be around the cost of living work that's already been commenced in the partnership. But I think we can go even further in what does that mean, both for the kind of poverty work more broadly and for the climate change impact that work needs to relate to. And then we come on to health and work, and there's a real kind of connection there across many different areas. There's the kind of health of the population. If we've got a healthier population, we've got a better placed workforce, we can be more productive in that way. There's in-work health and the people who are at risk of falling out of work due to ill health and how those 2 things interact. And then there's some explicit work needed with people who are furthest from the labour market. But it goes back to the point Alan made about this being a real 2-way street between a kind of economy currently struggling because of the impacts of ill health in our population. But also we recognise that some of the previous economic models that have been in place and some of the way we've been working have had a negative impact on people's health. So really thinking more broadly about that inclusive and well-being economy, and that'll play in both to the strategy piece but also some programme delivery. And then in the 3rd bucket of things, it's really about thinking about some of the stuff that Kathy talked about and advancing West Yorkshire and advancing that progress we've got, that ambition we've got across West Yorkshire to influence the national thinking on how this partnership comes together to really work on the social and economic development that we know is the 4th purpose of the ICS, but also real core activity around any future sort of devolution thinking as well. And so that future ambition, using the work that's done in place to articulate and highlight those examples that we can then use to develop thinking around national policy direction, really important. And we've got some examples in the paper of where we're actively engaged with those discussions. And that links to the point Kathy made about the comparison across other systems as well, and the work we're doing with the Health Foundation on that will help us there as well. So I just wanted to summarise the kind of approaches we're taking there. The work programme will continue to iterate as this develops. Fatima, did you want to come in and talk a little bit more under those sorts of examples where that inclusivity work really
No,
comes
I think you've covered it really well, Jen. I mean, the thing I would say is there's a caveat with the work plan that we've identified, which is it's really important that we engage with our elected leaders to co-produce the areas of inclusion that matters to them. So there's a sort of a punt right here, right now, that it'd be really great to connect with the leaders that are involved with the partnership board, but also the leaders of local authorities to see what inclusion means to you and how I can support you in your local places, but also to articulate the art of the possible. So look what we've done with race already. There's an opportunity for us to consolidate and build on that, as well as, you know, amplifying things like gender, for example, disability, sexuality. We're in Pride Month. So there are many things that we could do, but we need to focus, which is why your contributions and your thoughts as leaders is really crucial to the success of that. And I think also to really amplify the fact that we often think that sometimes the things that really matter to people aren't related to health. So, for example, culture is really important. Creative arts are really important to people's health and well-being, and there's an opportunity for us to work with Tracy and with colleagues that are already doing really good stuff on this in the mental health space to really amplify some of the good practice when it comes to creative arts and culture, which will then by default improve people's health outcomes too. So I'm going to stop there because I'm mindful of the time, but I'm happy to answer any questions.
Thank you very much. Thank you all for that pretty comprehensive coverage of the report and proposals. Can I invite any questions or comments on those? Yeah, Kathy. Yeah.
Just to say, and we've talked openly within the ICB, and I think in our partnership, that the NHS contributing to economic development perhaps is not a familiar thing. I think it's more familiar to us in our partnership. And I'm pleased that people like Jen have been invited to speak at the national conference that Rob was talking about earlier today. And we're referenced in so many case studies, but that doesn't mean we're closed to learning. And we know there are other systems like Dorset and Sussex we can exchange practice with. So we keep putting ourselves forward to join national forums, speak on things. Jen and I are going to the Health Devolution Commission session in Manchester in a couple of weeks as well. So we'll continue to bring back best practice. But I know, Tim, your colleagues across councils are also interested in this, whether it's lobbying, how we invite investment, or how we work together more effectively on this. So I hope we can continue this conversation at future meetings.
Yes, absolutely. Okay, thank you. So I think we're happy to endorse that approach and continue to support the work. And thank you very much, Rachel, Jen, and Alan for coming on and presenting it. Thank you. Okay, item 12 is developing the partnership board, which is very much summarising the development session we had at the last meeting and some learning from that. Ian, is Joe here as well? I'm not sure.
Yeah, I'm going to hand straight over to Joe. She always seems to get the last 2 minutes of these meetings,
Sorry about
unfortunately.
That, yes.
But
yes.
I'll hand straight over to Joe. Thanks.
Thanks, Ian. Thanks, Councillor Swift. I'll keep it brief because, as you've said, a number of people on the call will have been part of the session that we had in March. So this is a summary of what we covered and our plan for the next steps. So for those of you that don't know me, I'm Jo Farn. I'm the Associate Director for System and Leadership Development in the partnership. So yes, we had our development session in March, which was the first of hopefully a number of sessions of the partnership board. Purpose of that session was to review the last 3 or 4 years of the arrangements of the partnership board, and also to think about what changes we may need to make as we move into the more statutory arrangements going forward. And in summary from this session, there were 3 themes that came up from participants that warranted some further development discussion in future sessions. And those 3 things were the purpose of the partnership board, the priorities and content that we cover in the partnership board meetings, and the format of the sessions themselves. Just some specific examples which came up. I won't labour all of them, they're in your paper, but I'll just pick up a few just to illuminate those. Things like how we might create a sense of mutual accountability,
which would enable discussions to be one of collective responsibility of how we deliver and assure ourselves of progress in that kind of distributed leadership sense as a collective. That was one specific thing that came out. Another was around how we might align the content of the meetings with the recently refreshed 5-year strategy, and perhaps do a forward plan to focus on 2 or 3 of the ambitions each time we meet, so that we've got sight of that forward plan for a 12-month period. Notwithstanding that other things will emerge in between times, but broadly we've got sight of a forward plan, and a real keenness of the group to spend more time focused on the continual, I guess, more intangible development of the partnership board from a relationship and collaboration point of view, notwithstanding that one of the things that came out really strongly was that is a key strength of ours, but a real ambition to further deepen those relationships and the level of collaboration. We're suggesting that we would focus, have a development focus in every other partnership board meeting, but outside of the session in public, the more formal meeting. So on the morning of that same day, to meet face to face and to have a separate amount of time on those development discussions. You'll see in your paper that we've put a plan together, a proposal that would commence from September, and that September session would constitute the second of the face-to-face development sessions, and we're suggesting a focus on mutual accountability. So I'll pause there. What I think we're keen to get from Partnership Board this afternoon is any comments or further thoughts that you've got, but a support for the proposal, and then we can get on with it. Thank you, Councillor Swift.
Thanks very much, Jo. So, colleagues, any questions or comments? We're happy to endorse the proposals in the paper. Yeah, I'm getting some nods to that one, and so particularly the immediate thing is the proposal that the next meeting will be another in-person one with the development session alongside, and we're very content with that. So that's great. Thank you very much for your work on that, Jo. And I'm not aware of any other business, so I'll thank everybody for their attendance and contributions this afternoon, and confirm that our next meeting will indeed be on the 5th of September, and we'll confirm details of times and location for that nearer the time. But thank you very much, everybody, and enjoy the rest of your day. Thank you.